So when somebody comes into our office with TMJ, we take a look at everything. We want to take a look at the teeth and the bite because that affects what the jaw does. Then we take a look at the jaw, some muscles, jaw positioning, and we can put it all together to see what's going on with all of that. It's such an intricate system that we have between our teeth and our bite and our jaws. The way that our teeth fit will trigger certain muscles to work. So we want certain teeth to hit in certain jaw movements and other teeth not to hit. And when they're hitting when they're not supposed to, this can create muscle spasms, which can cause a breakdown in the jaw joint, which can lead to either acute or chronic TMJ symptoms. So many people wonder what it is like to treat TMJ. So from a perspective of a patient, it's actually pretty simplified, but there's a lot of science and things that go behind it as well too. What we work with is what we call a splint, which is kind of a specialized retainer, and we usually make it to fit on your bottom teeth because it's important to wear it all the time. If you're not wearing it, your teeth are throwing the jaw out of alignment. So we have people wear it all the time except for probably eating and brushing. And as you wear the splint, we make sure it's balanced very well with your teeth and your bite, the way that you move your jaw. And as it stays balanced, it allows the muscles to relax. As the muscles relax, the jaw is able to move into its more centered position. But then as the jaw moves, the splint gets off balance. So we have you come in about once every 1 to 3 weeks as we adjust this splint to keep it nice and balanced so the muscles can continue to relax with that. And then over a period of averages about 3 or 4 months, this jaw will go into the right position where it's more stable and relaxed as well. But it doesn't take 3 or 4 months to feel better. Usually within about a week, you'll start to see a big difference with the way the muscles feel. The headaches will start to get better as well too. But then at the end of the treatment, whether it's 3 or 4 months or if it takes a little longer, when we get the jaw in the right spot, then we have to take a look at the bite and see where the interferences are with the teeth that are throwing the jaw out of alignment in the first place. At that point, we'll re-look at the bite and see where these interferences are. And then we'll make a plan on how we can correct the interferences. If the interferences are small, sometimes we can just do a little adjusting on the teeth to grind them down to get everything to fit together. But if it's more than what we can safely adjust on the teeth, because we don't want to put the teeth at risk, then we may need to consider moving the teeth to get them to hold the jaw in the right spot. And as we move the teeth, we don't necessarily have to use braces. We can use clear aligners. There's a lot of different ways that we can go about moving the teeth as well too, especially with a lot of adults. They don't necessarily want to wear braces or wear braces again. So we've developed a specialized clear aligner system that helps us treat the bites with TMJ. Everybody is different as the way they respond. Some people respond very quickly. Most people actually feel a difference within a week as far as how their jaw's feeling, the headaches start to go away, but some don't respond quite as quickly. So my commitment is that we work through a whole different variations of systems that we have to make sure that we can get this jaw to calm down and get the jaw to be in the right position, and then we can work to fix the bite to hold it in that place long term. So when we look at effective TMJ treatment, it's really teamwork between us and the patient. Because of course, if the patient doesn't wear what we've asked them to wear, nothing will happen. So it's really important as we go through this process for people to really do what we ask them to do, wearing the splint. It might be a little challenging at first to get used to it, sometimes a little bit uncomfortable for the first few days. But I tell people if they hang in there, they'll get used to it, and they do. And then after a while, they'll be lost without their splint. So it's important to really hang in there and do what we're asking you to do, because there is a light at the end of the tunnel. We can get this feeling better for you. Success for me is that we can get people out of pain and we get their bite fixed so long term they won't have to worry about pain ever coming back.